But in November of 2006, we were challenged by the Berger Commission that called for profound change across the state of New York. And I recall being one of the few CEOs who raised the hand and said, we're willing to change. Give us with the right vision, the right plan, the right funding, and the right timetable, we could really take Western New York and do something very special by embracing change. And our motto at that time, and it remains today, that everything we do, we want to take what we have, which is very good, and we want to make it better. And what we're doing today is building upon the vision and the leadership of people who've come before us. This is a cumulative process. This is not an individual process. This is a process of building. If you look at the video, which is an amazing compilation by our web guys that had a webcam on this project from the beginning and has compressed the last 2 years of construction. But what we're doing is we're building on the past, we're building for the future. And I want to acknowledge two individuals with us today who really had the vision of this Buffalo Niagara Medical Campus to really concentrate and bring together very complex services and programs into one location. And today joining us is our former mayor, the Honorable Tony Masiello. I've seen Tony here somewhere. I hope he's still there. Tony. Tony as mayor, and now my neighbor, was really credited with this vision of pull this together for the future of our region. And then Tom Beecher, a volunteer from the community, stepped forward to really bring the parties together into a consortium, into a partnership to really allow us to focus to create this wonderful campus. And then that vision just compounded itself with partnerships with the Buffalo Medical Group, with UB, with Roswell Park, Hopman Woodward, all the various parties that are now coming together to create this wonderful medical campus. My core philosophy is change is opportunity. And opportunity is adaptation. And through adaptation, we really can transform how we do business, how we care for people, and how we deliver service. And today, we continue to embrace that call to action. And when we think that we are going to recognize an individual, especially at the end of this program, by dedicating this center in his honor, Ted Walsh, and we think of his 25 years of service, it's again an example of building on individuals who've contributed so much of their time and talent and intellect and resources to make this vision a reality. When you think back at the groundbreaking in August of 2009, I will admit that while I was making my comments, I looked out and I thought as we were starting to bring the steel in that we needed to set a date of when we're going to open this. And out of the blue, I had some science behind it, but out of the blue, I said, we're opening 11/11/11. And I want to say we're opening 11/11/11. This emergency center opens November 11th. And when you think about, and I remember looking out of the audience for the folks from Turner, from Canon, from our own teams, saying, what did he just say? And what it was is we needed to stay focused. We needed to stay energized that we could get this done because so often, in particular in Western New York, things languish. We talk about it, but we don't get it done. So here we are with assembled a wonderful team, Turner, Canon, the building trades. We have our internal team with Joe Kessler, Rob Bragg. We call this the house that Mickey built, and Dave Croston, Pete Murphy, Tammy Owen, Connie Vari, everybody. And I could go on, and that's a danger of starting one of those lists, is that there are so many wonderful people that are part of my team that really making this happen for our community. So what's going to happen now is this ER actually becomes functional. The Buffalo General Emergency Room closes on November 11th, and they come over here and they begin to care for patients out of this center. By the end of the year, the new helipad on the 16th floor of the Buffalo General opens up so that we can bring in the individuals with complex heart, complex stroke, not trauma, that's our partners at ECMC, but really bring them in and have direct elevator access into this center and into the cath labs that are going to be opening soon. And then in the meantime, we're completing the integration of the Gates and Buffalo General. Gates and Buffalo General come together on March 31st, two become one. And we're going to be opening the new Buffalo General Medical Center here on the Buffalo Niagara Medical Campus as we bring together this complex of services and programs. So Gates and Buffalo General come over. So the emergency room, the people and programs of Gates come here, join forces as we come back in another about 4 months, and we'll have another dedication as we open the new Gates Vascular Institute here for Western New York. So very exciting. So by the end of March 2012, this complex will be fully functional. Gates will be mothballed for the time being while we look for reuse, and we'll have this new complex serving the community. So, as I said at the groundbreaking, and I'll say it again, the future is before us. What I'd like to do now is to introduce the individual who will assume the leadership role, my Chief Operating Officer, Executive Vice President Connie Vari. We've gone through a recent restructuring, and given how we are looking at the future of healthcare, how we really need to concentrate programs and services, I wanted to pick the best and the brightest to lead this new complex. And Connie Vari is going to be, has already begun as president of the Buffalo General Medical Center, and will also continue as the number 2 for Kaleida. But Connie, could you share a few remarks for us? Thank you.
Now I see everybody all together. Is this exciting or what? Let me, as usual, Jim takes most of the words I'm going to say, so let me add one thing that we omitted, because this is a very exciting day. It is the first of many, but we also, the next event that will occur is actually on December 3rd and 4th. The new long-term care facility, High Point, that you saw in Michigan, will be opening, and will provide a new home for all of our residents at our Gate Circle and our Deaconess facilities, which house 20 children as well. So that will give them a very home-like environment, so we're excited about that, in addition to all of our other moves. Today is really a culmination of 5 years of planning. And 5 years of planning that was truly physician-led. And many of our physicians, I'm not going to name them today because I'll get in trouble, but because I will forget one of them. But our physicians truly worked hand in hand with all of us to design the best throughput, the best state-of-the-art facility that could enhance not only the quality of care, but our efficiency. And today, I call this, the vision became the reality. This is the first step of 5. Ted, we're very much honored from the leadership you've given us over the past years, and that you continue to give, and to name this in your honor, and to all of your family members who give so generously in our community. Jim alluded to the team. One of my colleagues, who's been the project manager, who has the 60,000 line list of things we have to get done to make this building a reality, said, I think we should just refer to this as an army of people, because that's the only way we can truly, it has been a community event in addition to Kaleida. We have union members from the construction halls who have worked tirelessly at all hours to achieve that 11/11 date. Our staff from all the organization, but primarily Buffalo General and Gates, have come together to become one, to learn from each other, to choose the best, to design the best programs and processes that will serve our community well. Our management team has stretched themselves between the 2 facilities to make sure that we had the best structure when we started at the most reasonable cost, knowing the demands in healthcare today. And our physicians have given countless hours to make sure, once again, that we could drive quality, programs, and services. So when I look at integration, and we refer to it as the integration is so involved. It's not just these beautiful facilities that we see today, but it is truly about bringing programs, services, and people together to enhance the care in our community, which is what we're all about. So lastly, I would like to share with you, as a Buffalo native, celebrating 35 years at Kaleida this past year, as a nurse, as the past president of Gate Circle Hospital, as the chief operating officer of the system, and now the president of this beautiful campus that we're bringing to this community. The thanks to my entire team, and again, I'm not going to name them all because we'd be here for a while and I would accidentally forget one. I invite you to join us in communicating to everyone you know the gift that this community has by this new facility that will serve us well and well into the future. Thank you.
The next two individuals I'd like to introduce are Doctors Janicki and McCormick, our emergency room leaders, recently recognized at the Kaleida Ball for the Kaleida Spirit Award because of their leadership. These are two individuals who led this physician leadership process that ended up in the design and the creation of this emergency center. And they've also done something very unique and I think representative of the future for Western New York physician alignment, is they brought academics and private practice together and they've created a virtual group, a win-win group between the group that covers the Gates, the Suburban, as well as the group that covers here at the General, and they've created a seamless group to cover this emergency center where we're going to advance the exceptional clinical services, teaching of future doctors and healthcare professionals, as well as conducting research in an emergency center of this magnitude. And they've created this new group to be able to staff and serve the people of Western New York. So Dr. McCormick and Janicki, please.
Good morning. Good morning. Mr. Walsh, I congratulate you. I will tell you, I think that you'll be very proud and you'll see many innovative changes in healthcare through our emergency department. Congratulations. The other thing that I wanted to say here was that I think a very important factor that we've kind of mentioned is teamwork. And you can imagine the teamwork that it took to build this building. It was massive, right? It's huge, this building, and very complicated. And it took a team to put this together. But now we're to the next step. We have to take this building and make it a healthcare facility that'll give our patients the very best of care. One other thing I wanted to say was I think that Kaleida really has stepped up to the plate. I mean, this is a huge endeavor, a huge investment in our community. And I think that Mr. Caskey should be congratulated and his team. I have a quote just to finish with because, again, I think the teamwork and team building is so important. And this is a quote actually by Henry Ford. So coming together is a beginning. Keeping together is progress. And working together is success. So we're all about success. Thank you.
Thank you. Thank you all for coming and seeing the new emergency department here. We're much happier that you're here to look at it rather than be treated, but we're ready for that too. And I would say thank you to Kaleida administration and to the board and Mr. Walsh particularly because it took a tremendous amount of courage to follow this vision through and to extend themselves. You know, the place speaks for itself. It is truly phenomenal. I took the residents through the other day, and one of them said it's like an Apple store. And I agree. It is just state of the art. It's beautiful. And if you look, just when you look at the patient rooms, it's really about the patients. Everybody has a private room, has a door that closes to give them greater privacy. Each room has a thermostat for their own control. Each room has a TV. It's really about the patients, and I think we're going to be able to provide fantastic patient care here. And the last thing I want to say, what isn't apparent here, is what really makes this place unique is the staff. The staff from Buffalo General, the staff from Gates, everybody from housekeeping, security, imaging, the nursing, and the physician and mid-level staff. They're coming together. They're excited about working here, and that's really going to make the difference. So thank you for this opportunity. It's really a great moment.
The next individual I'd like to introduce is our honoree. When you think about as you come in and you see the Edward Walsh Emergency Center as you come through the doors and you say, and I can see people in the future go, I wonder who this guy Walsh was. And that's a very important question. And I want to share why this is the Walsh Emergency Center, not only for Ted as an individual, but when you think about the legacy and the tradition of the Walsh family in service to this community, it's a remarkable 4 to 5 generation story. But when you think about a time of profound change, be it in the demographics of Western New York, the economy, be it in profound change in healthcare, when you think about the profound change of bringing together disparate parties such as the Buffalo General, Children's, the Millard system to create Kaleida Health, and then you see further embracing of evolution and change when you see Kaleida Health embrace the Berger Commission and be able to create Great Lakes Health, which formed the collaborative model between ECMC and Kaleida. All that requires individuals who don't have the orientation or the agenda of a CEO, they don't have a parochial vision of an institution, but they have a vision about their community. And they have a vision about what is really essential for the community and how can we best use these assets, which do not belong to anyone other than this community, for service to the community. And when you think of an individual who has served over 25 years, he began it from the nursery at Buffalo General, if you look at Ted. But really, 25 years ago, volunteer service, uninterrupted, that began with the foundation of the Buffalo General and came through to include chairmanship of the Kaleida Board for extended period of time, probably 6 years, as well as continued service on the Great Lakes Board and continued service on the finance, investment, and other programs and services, and is leading the Gates Reuse Project. I mean, this is a guy that just never says no. And then all the other community activities he's involved in. We believed, as we stepped back, myself with the board, and said we need to honor an individual who has committed so much of their life to this community, and therefore we commit this emergency room in your honor, Ted.
Wow. It's so great looking out at all the folks that are here. So many of you had such a key part of making this moment come to fruition. And I think this is a great Kaleida Day, an ECMC Day, a Great Lakes Health Day, a Buffalo Niagara Medical Campus Day, and I think a great day for Western New York. And I'm honored and humbled to have this recognition, and to be honest, a little overwhelmed by it. And I wish we could put all the names of the hundreds of people that sort of were all part of this process. I just happened to have the leadership moment when it all came together. So thank you to lots of friends and family, this wonderful gang up here, and work colleagues, many are family, but they're all true friends, for being here. I've got two granddaughters here that I'd like to just mention. Avery, who's 4 and is wearing a beautiful polka dot dress. And Haley, who turned 2 yesterday, and we're having a family party after this for Haley. And if you see her on the way out, you could wish her happy birthday. Jim Caskey and I have forged an amazing friendship during our time of working together. When he said 11, 11, 11 at the groundbreaking, I saw all of the construction gang wince. But it's amazing the power of setting a bar, setting a goal, and I think that's inspirational of a leader to get the team to pull it off. This is the first of many, and I look forward to many of the other moments where we'll gather and we'll celebrate all the incredible things that are happening on this campus. But as exciting and fresh and magnificent as this building is, it really comes down to the people that provide the care and the leadership of 2 extraordinary physicians over here who will help lead that team. And I know this isn't a place we want to visit very often, but it is comforting to know that it's here. And I think of it as a beacon of hope for those moments when you're a little worried that something has happened to you or someone you care about. And we've got some extraordinary physicians and nurses and other caregivers. And I feel very blessed that this is here for our community in Western New York. There's one person I'd like to mention, and that's my father, who's up in the second row here. A number of years ago, he was the chair of the board of Buffalo General Hospital. In the tower that's over here, the 16-story tower, he was the driving force that made that happen under his leadership. And we have a photograph at home that has Dad signing the girder, which was when they were doing the topping off ceremony. So Dad's name is on that, but it's inside a wall. No one would know it other than a few of us that were here that day when they took the picture. But how fitting it is now, Dad, that your name gets to be down on the first floor for people to see. And I'm very honored to have my junior after your name.
One of the wonderful things about leadership, and particularly volunteer leadership, and what Ted has done as he chaired the board is to ensure that we have a board, and there are many board members here today, and we thank you for coming out, but also to make sure that the leadership of the board continues intact and adapts to the ever-changing agenda and ever-changing environment. And I'd like to call upon John Colmel, the chair of the board of Kaleida Health, to join me at the podium to recognize Ted with a special plaque, and then John will close our program. But John is giving of himself, his talent, his intellect, to really drive us to the next generation of strategic thinking, of performance, and of adaptation as we look to ever find new ways to serve this community. So, John? So, John, we're going to present to Ted a little memento of the Edward F. Walsh, Jr. Emergency Department, Ellicott and North Street, Buffalo, New York, dedicated Saturday, November 5th, 2011. So, Ted, join us.
Thank you very much, Jim, and certainly want to add my warm welcome and appreciation for everyone taking time today for what's been said multiple times, and I'll add my perspectives. This is an incredibly wonderful and proud day for all of us, Buffalo, Western New York, as well as those here today. Can't help but be excited. It's a beautiful, sunny November day in Buffalo. You drive into the campus, as Connie's already referenced, the long-term care facility. You see that very much coming to life. The parking garage. Yep, we do need a place to put cars, and the good news is we'll have one. Obviously, the incredible wonders of this facility just can't help you, but really appreciate the vibrancy of the campus, the excellence that it's already providing, and the excellence that it will provide for many years to come, in the centerpiece that it will be for this community as we continue to rebuild and strengthen Buffalo and Western New York. It's also ironic, it's been a very proud week for Kaleida. It's, I think, other than coincidental. The stars have aligned. Thursday night, many of us were at a reception and a dinner where Jim Caskey was honored and recognized as Executive of the Year in Buffalo and Western New York. And yesterday, hopefully some of you had the opportunity to participate in recognizing Connie with the Athena Award and for her leadership and service and advocacy on behalf of the community and women at large. So I want to take a moment and provide a round of applause for both of them. Good things do happen to good people, and good things do happen when good people work together for the benefit of the greater good. And it's on that point my comments will focus as we do close. I've had the opportunity, given my circumstance, to speak a number of times over the last few years, and I've since had put back to me a phrase that I've used, which is that we've gotten in our own way as a community too often. And I talk about egos plus politics has made Buffalo a process town. And it's a bit of a soapbox I've been on any time I can get. What we see today and why we're here is the antithesis of that. This is real progress, and this is what's going to move Buffalo forward. Couldn't be more proud of everyone that's been part of it. Clearly couldn't be more proud of Ted's leadership in pulling the train, setting the pace, along with Jim and many, many others, to ensure we're here and can celebrate. And with that, I do want to ensure we've appropriately thanked and again recognized the many who have made this a reality. You've already heard from both Connie and Jim, Drs. Janicki and McCormick. That's what really got this done, is the physician leadership, the docs, as they're affectionately referred. Without them, we wouldn't have made this happen. 11-11-11 would have been 11-11 something else if it wasn't for them. Yep, it took a tremendous effort on the part of many others to physically build it, but it starts with their leadership, their conviction, and their willingness to collaborate for the benefit of all. Clearly, the community at large, the support's been tremendous. It's wonderful to see this kind of turnout on a Saturday morning, and I think well exhibits the kind of pride that we all have in making good things happen for the betterment of the community. The Kaleida team, they've been recognized and honored. I can only assure you, the work ethic, the commitment, the passion, these are not easy times in the world of healthcare. And the organization itself is forever transforming and reinventing on the fly. And to be able to do that and bring all of this to life, resurrect this from the ground literally, is just a tremendous accomplishment and a kudo to many of them. Certainly the Turner team, saw them at last night's UB Gala. They're here again today. Cannon and Labor and the many, many others that have worked tirelessly to do that. Saw Tom Beecher and Matt Enstis on my way in. Again, the vision, the leadership, the conviction, the passion that they've continued as well. This is a great example of a public-private collaboration. Clearly the state, the HEAL money, it's been a significant investment literally in this. Wouldn't have made it happen. Joe Kessler and his group very creatively have worked to finance and ensure we can bring it to life, but it's been a great public and private collaboration to achieve that outcome as well. And I'd be remiss if I didn't thank, as has already been acknowledged, the long-serving and continuing service from many of my fellow Kaleida board members who are here today and others who couldn't join us. And obviously it was under Ted's leadership and stewardship that this really came to life, and I'm pleased to have the opportunity, to represent all of them. So as has been said multiple times already, an incredibly proud day for Buffalo and Western New York. Clearly an incredibly proud day for Kaleida and the health system, and I know for the Walsh family as well. I've had the wonderful opportunity to know many of them for different reasons over the years. It's great to see them assembled, not only here in the front three rows, but elsewhere, and I know they'll smile for all the more reasons at the birthday celebration this afternoon. And Ted, Jack, Barney, Michael, Ed, the whole family, kudos and congratulations to all of you. So we, as a board, I as an individual, very pleased to have this opportunity to talk about consolidation, rationalization, collaboration, and ultimately transformation. Transformation that sets Buffalo and healthcare in Western New York on a much better path. Appreciate all of you being here. Appreciate you joining in the celebration. Encourage you, if you haven't already, to walk around, take it all in, because we really have created something special. Thanks so much, everyone. Have a great day.
Cecilia, I got equal time. We have two of our grandchildren here. But Cecilia, you want to come up? We should sing happy birthday to Haley. Come on. And she can do it in Italian. So should we sing happy birthday to Haley? Happy birthday to you. Happy birthday to you. Happy birthday, dear Haley. Happy birthday to you. Want to get that? Okay, now Italian. Oh, okay. Yay! All right. Enjoy.